Hello, my name is Rachel Bobst, and I am an LPC in the state of Idaho, and I'm a certified sex addiction therapist, otherwise known as a CSAT. In my practice, Restoration Road, I solely work with men and women who are struggling with unwanted sexual behaviors, along with partners that have been betrayed through such behaviors. Through this process of therapy, which is in essence on the road to restoration, there are multiple strategies a CSAT would use to provide a constructive environment. One of those strategies is called formal disclosure, and the assessment that I'll be introducing to you today is in direct relationship to that process. In order to get the full scope of why I would create an assessment like I did and what I'm trying to measure, you really need to understand a few things first. You need to understand what betrayal trauma is and what the process of disclosure looks like. Betrayal trauma is what happens to a person when someone they deeply rely on for love, safety, or support, like a partner, parent, or close friend, breaks the trust in a serious and oftentimes violating way. The body and mind of the betrayed partner can react like they're in danger. This happens because the person who is supposed to protect or care for them has become unsafe. Betrayal trauma shakes the person's sense of security deeply. A person experiencing betrayal trauma can feel confused, overwhelmed, and at times even feel paralyzed. Okay, so now what exactly is disclosure? Well, disclosure in the context of betrayal trauma involves a couple. One person in the duo is the betrayed partner, and the other is the partner who did the betraying. Both parties of the couple show up to communicate with skilled therapists. They do this in a safe and formal way. The person who caused the harm through infidelity or secret behaviors tells the truth about what really happened in the marriage within a given time frame. The betrayed partner then has the opportunity to listen and understand the scope of hidden behaviors with therapist present to help facilitate safety. So you may be asking, why do this? Well, disclosure is a tool that promotes transparency and connection. It is a process to which the betraying partner chooses honesty and repair over self protection and isolation. It is more than just confessing, it is a type of restitution to the injustice within the relationship. The betraying partner takes a step towards repairing the rupture that their secrecy created within the marriage. As Dr. Jake Porter noted in his YouTube talk, What Years of Betrayal Trauma Has Taught Me, disclosures offer empowerment to show up freely in relationship. The disclosure is a technique that offers the reality of the relationship to be revealed. It, in essence, empowers the betrayed partner. This all being said, while incredibly healing and informative, disclosures can be very triggering and harmful if all parties involved are not postured properly. Janice Cottle and Dan Drake note in their book on full disclosure that full disclosure is both painful and healing, and that 88% of betrayed partners and 81% of those disclosing reported that the benefits outweighed the pain. So then, what's the issue? Well, the betrayed partner must have the emotional bandwidth to hear the information and remain grounded and stable. The partner who has betrayed must be able to not only provide truth, empathy, and clarity, but also must understand the emotional footing of the betrayed partner. They must be able to take responsibility and understand the full scope of their behaviors, what those behaviors have done, and who they have affected. If the betrayed partner or partner who has been betrayed is not emotionally ready for this event, you can imagine the harm that can be done. This is where the ERAD and ERAB come in. The Emotional Readiness Assessment Disclosure and the Emotional Readiness Assessment Betrayed are diagnostic, multi perspective tools designed to assess the emotional, psychological, and relational readiness of couples considering the disclosure of infidelity. These instruments aim to assist therapists and clients in making informed, clinically sound decisions regarding the timing and structure of disclosure. These tools serve several purposes. They're diagnostic guides. They help determine whether both the disclosing partner and the betrayed partner are emotionally ready to engage in the disclosure process. They're therapist aids. They help facilitate comparisons between client self perceptions and therapist reflections. There are pacing tools. They support decisions related to the timing of disclosure. And they're structured pre disclosure frameworks. They act as a type of barometer to identify areas that may require therapeutic growth prior to the disclosure taking place. So here's the ERAD. The ERAD is a Likert scale assessment, and although it rests on a quantitative backbone, it also has a layer of clinical insight with the therapist evaluation sheet and a contextual cross check with the ERAB. So, looking at the ERAD, you can easily see the subscales on the left and then the statements within that realm. The client would choose an answer anywhere from strongly agree to strongly disagree for each question. For the sake of this presentation, I will only be reviewing the ERAD. The ERAB, however, works the exact same way, but with different subscales that are specific for a betrayed partner. And a therapist evaluation form will coincide with each assessment. Here are the ERAD subscales and the ERAB subscales. I included them both here because I wanted you to see that while the ERAD supports accountability and ownership, the ERAB looks different in that it is more about safety, stability, and self-protection. So the idea would be that there are questions presented or statements within each subscale. The client would answer each question to the best of their ability. And then with that information, each subscale would have a score. Then each subscale would get added up in order to get an overall score to determine the emotional readiness and clinical recommendation for the formal disclosure. If there is a weak subscale, the therapist would be able to easily indicate that and work on that subscale area prior to disclosure. The ERAD can be placed easily into Google Forms and then sent out to clients with a link. The totals then can be compiled and revealed in a Google Sheet. The nice thing about doing it digitally is that the questions can be out of order of each subscale, though this way the client doesn't see the subscales that they're working within. A therapist might be able to get more information around readiness if done this way. Another option could be doing this mixture of subscale questions during a retest situation. Here is the subscale totals graph at the bottom, so you can take each subscale, add them up, and this will give you a final number. This final page indicates the diagnostic scoring guidelines. I indicated the diagnostic readiness based on the final number score, but also the clinical recommendation. It is important to remember that we're therapists, however, and so we would need to use our clinical judgment as we're moving forward. This is definitely where the therapist evaluation will come in, that is created for the ERAB and ERAD. The conceptual framework for the ERAD and ERAB was created and based on the work presented by the pioneers here. We have Patrick Carnes and his work on integrity and honesty. The ERAD promotes the necessary work needed for a full disclosure of truth. We have Jennifer Freud, her work with betrayal trauma and how a victim of betrayal trauma can have responses that are intertwined with their attachment and survival needs. The ERAB provides a clinical barometer to stabilization. Bowlby and Ainsworth and attachment theory. This theory was originally conceptualized by Bowlby and then extended by Ainsworth. It focuses on emotional regulation and empathy and relational safety. The ERAD gives the therapist an opportunity to see if the partner who has betrayed is attuned, can co-regulate, and offer security in a moment of disclosure. We have Judith Herman's three-phase model of trauma recovery. It promotes the stabilization of a person before they go into storytelling. The ERAD provides a therapist's guide to stabilization. Janice Cottle and her full disclosure model. The ERAD incorporates the need to assess internal motivation and willingness for accountability and true connection. Now with these tests, there are some noted strengths and limitations. Some of the strengths are they do have a dual lens design, meaning that they are comprised of three parts: the ERAD, ERAB, and therapist evaluation. And I did this in order to help identify blind spots. They have a good structure, they acknowledge trauma components, and they are respectful of the nervous system. They provide a lot of psychoeducation that can enhance understanding. There is a lot of practicality. They're user-friendly and very cost-effective. There's multiple formats, so they're accessible for various therapists' needs, and clients can use them at home. And they have good test retest options. The tests can be given via paper with subscales available, and then again in Google with the questions mixed up. Some of the limitations are the self-report bias. Clients may inaccurately report readiness due to emotions. The lack of normative data. We do not have large-scale validation results, so we would need to complement them highly with clinical observations. Context sensitivity. Readiness may vary with emotional and relational shifts. No deception screening. There is no validity scales for manipulation or deception. There is some culture and gender role bias. The ERAD and ERAB may overlook norms against emotional expression with different cultures or social structures. Relational readiness is not guaranteed. High scores reflect personal readiness, not relational repairability. And clinical judgment is, required. So the scores serve as tools, but we do need clinical judgment as well. So in order to strengthen the ERAD and the ERAB, there are a few ethical things that can be done. We can use the ERAD in conjunction with the therapist and partner assessments. This ensures fairness and would help avoid bias. We can repeat at multiple intervals. This will give opportunity for the person taking the test to be aware of what is being measured and what they need to be working on. It also can help build confidence. We could pair it with psychoeducation and pre-disclosure coaching. This will be helpful because we want our clients to understand why it would be necessary to be emotionally intelligent in these subcategories. And lastly, we can treat it as a conversation guide and not as a pass-fail test, and this will build rapport. So here we have 4 validity types along with the definitions of the validity type, the ERAD application, and also the preliminary support. We have content validity. Does the ERAD capture what I want it to, which is emotional readiness? We have face validity. Does the ERAD show all the measures? We have construct validity. Do ERAD scores align with related measures? And lastly, we have criterion validity. Does the ERAD provide scores that predict either smoother disclosures or derailment? So now that I've explained the premise of the ERAD and ERAB, and you understand the strengths, ethical limitations, and validity types reviewed, I was wanting to leave you with some questions. Do numbers, Likert scores, feel more useful to you in guiding readiness, or does narrative observation hold more weight? If you were handed a tool like the ERAD, what would make you trust the results? And lastly, where do you imagine resistance might show up from clients or even therapists when introducing something like this? Well, again, this is Rachel Bobst. Thank you so much for watching the ERAD assessment. I look forward to not only hearing your feedback, but seeing what each of you has created and why. Following this slide, there are some references, and those references are included on your slide handouts. Thank you.